a rescuer's heart, so I've done that since I was a child and watched my mom do it, and so I've just always wanted to be there to help the helpless and try to be their voice. Vaccines are very important because they prevent a lot of diseases, and so many diseases that can be prevented can also be treated, but it's much more effective to prevent a disease. And there's also some of these diseases like rabies, which humans can contract. So if your pet's not vaccinated and they're bitten by a pet that has, or an animal that has rabies, we potentially could contract rabies, which is a deadly virus. But there's many other diseases with cats and dogs, like respiratory diseases, different viral diseases that affect the immune system or the gastrointestinal tract. And just by vaccinating, they build up an immunity to those diseases, and therefore, if they're in contact with them, they don't contract them, and therefore don't have to be treated for them. Many of these diseases can be life-threatening as well, especially without treatment. So, again, just to try and prevent disease spread is really the reason for vaccines. Microchipping actually gets a lot of animals back to their owners. Sometimes accidents happen, a door or a gate is left open, a dog may escape or jump over a fence. And so if they're microchipped, they're brought, to any vet, animal control. Most rescues have scanners as well. And once they're scanned, the owner's information can be, they can be contacted and reunited with their pet. So we'll have dog as well as cat vaccines. For dogs, we'll have rabies, distemper parvo with leptospirosis, as well as bordetella. So obviously rabies protects against a deadly virus. Distemper parvo with leptospirosis, that covers many viral diseases like parvo and distemper. And then leptospirosis is a bacteria that is spread in the environment through rodent urine. It sits in stagnant water, and so that can affect the liver and kidneys, and that is also a disease that we can contract, so that was important to vaccinate against. Bordetella protects them against some kind of a group of respiratory diseases called kennel cough. And then for cats, we will have, again, rabies, we will have FERCP and leukemia. So those are kind of a group of viral diseases as well as upper respiratory diseases that cats can contract. So this is our lab area. So this is where we run fecal tests, any blood work, just any tests that we need to try and figure out what's going on with an animal. This is our pharmacy. So this is where most of the drugs are kept that we use to treat the patient area. So this is kind of where all the pets stay if they're coming in for a procedure or they need to be examined. Today we have a dental procedure going on, so we have dental x-rays, the dental machine to clean the teeth. And then we have that's my dog Scooby, the tan one. He actually showed up here very injured.
Say that again?
I said he showed up here at the hospital very injured, just outside, and we took him in and fixed him, and now he's my soul dog. Kitty right here, I had to extract all of his teeth yesterday. He has no teeth left.
Oh, that's no fun.
So much better.
Look at the face.
Hi, Jordan.
Hi.
That again?
This is Heather. She's getting the surgery room ready for the cat basket. So it has a bunch of cat toys, a cat bed, blanket, treats, a laser pointer, as well as some shampoo and mousse to help keep your cat entertained. Perfect. So again, we have a bed, a blanket, a bunch of toys, some dental chews, shampoo, and mousse, and a gift certificate to use here towards their care.
Thank you so much.
You're welcome.
Dr. Becker, who's this?
This is my daughter Raylene, and she has the animal passion as well.
Yay. Are you going to be at the event? What are you going to do?
I don't know.
Okay.